Well, thank you everyone for coming along today. As we announced there, we're going to be discussing privacy considerations when designing social network systems to support successful aging. Now, intuitively, privacy is a very simple concept. We know what it is because we all want it in some form or another. But just as stereotypes of people can actually be misleading for us, sometimes stereotypical views of what privacy is can be really quite misleading. We think, for example, that privacy is about hiding our personal information from others and just keeping it to close friends and family who we trust to be able to see it. But sometimes privacy is actually a lot more complex than that. One participant that I talked to in my research told me about how he had finished a football match and he was coming away with some of his friends when he had an angina attack. And he had these severe chest pains, but he didn't say anything at all to his friends with him. And he got into the taxi, went back home again. He didn't tell his wife because he didn't want to scare her. And the next day he went straight to the clinic. When he was at the clinic, the medical staff there told him that he couldn't go home and he had to go straight to the hospital. And then he laughed and he said, well, that was when I had to tell my wife. So you see, privacy is complex. It's dynamic, it's subtle, because sometimes it means that you'll want to withhold information from those who are closest to you. And understanding it better is vital for good design. Now, as part of an EU-funded project called Canto, we want to design a social network system for older adults. But we want to go beyond merely online contact for our users. We looked at sites like meetup.com and really liked that idea of getting people together online and getting them to do activities offline. We looked as well at the idea of social prescribing, where health professionals tried to improve the well-being of service users by recommending that they get involved in activities in their local areas that they would be interested in. And we thought to ourselves, what if a recommender system could do something like that for us? And what if we could link up this social network system with the recommender system so that older adults could sign up, they could state their interests, and then they would receive recommendations about interesting activities in their area? Because for us, that would go a long way to reducing social isolation, reducing physical inactivity, and making people more socially and physically involved. And so part of the system then would be built into their smartphone or their tablet. It would record information about the activities they are attending, how active they are, how socially involved they are, and its effects on their well-being. And so if we saw, for example, that someone was staying at home a lot, we would be able to provide some recommendations for them, that they go out with their friends, get involved in some activities that we'd provided in the system. And so it's all about trying to motivate our users to achieve targets of physical and social activity that would improve their well-being. And potentially, of course, health professionals for some users could feed some information in there as well to try and set some of these targets to make people more active. But the problem, of course, with all of this, it all sounds very good, is that it gathers an awful lot of data about the users, their interests, their activities, their well-being, and that opens up huge privacy issues. And this actually is one of the reasons why some older adults don't use online social networks. They hear stories about older adults getting into trouble because they hear stories rather about younger adults oversharing information on social media. And they get quite anxious about that. They discover through their own experience that sometimes they're wanting to share a message with a friend and they inadvertently share it with all their friends and contacts. And so they start to become very wary of using social network systems. And one study in 2009 by Lynne and colleagues introduced a small group of older users to a social network system and discovered there that the privacy issues were enormous. They were restricted in the types of information that they would share. They wouldn't share photographs. They wouldn't discuss the things that they would ordinarily discuss because of these privacy concerns. So they're a clear hindrance. So our question is this: how can we design privacy for older adults in the context of a social network system? But to start off with, we wanted to ask a slightly smaller question. What are the privacy and information disclosure habits of older adults in their offline social networks? And to answer this question, we invited a group of older adults, 6 older adults, to come along, have a cup of tea with us, and to map out their offline social networks. And the tool commonly used to do this is known as a participant-aided sociogram, where people write out on little sticky notes the names of relatively close friends and family and acquaintances, and then place those labels in concentric circles based on how close they are to the self, which is at the center of these circles. And then the stickers are grouped together based on the closeness of the different individuals to each other, and circles are drawn around them. And you can see here an example from one participant. He's circled his ex-work colleagues, his walking group, his church friends, and so on. And it visualizes very nicely the relationship of these different individuals to the participant. And at this stage, then, we started to ask participants some questions based upon the types of information that we wanted to gather in our social network system. And we would ask them questions like, well, who would you share your location information with based upon this network diagram that you've produced? And for many participants, they were actually rather happy to share the location information with all of their friends because, as one participant said, I got nothing to hide. But another person was really quite careful about the whole business. And it all came down to what the person was like who was getting the information. And you can see here in this quote the way the participant categorizes different people based on their characteristics. Some people are over the top and hysterical. Other people are sensible. Other people are nosy. And it struck us that if this was the case, the important issue in privacy was preventing friends from seeing sensitive information and not just strangers. Another question that we asked was about sharing moods. So in our proposed social network system, using the features in a person's smartphone or tablet, we could use the front-facing camera. And that would be able to give us information about their facial expressions while they were involved in different activities. And this system's still under development, of course, but we proposed that we'd be able to decide whether or not a person was enjoying an activity or not enjoying it, and then adjust the recommendations accordingly as to whether we would recommend that activity again or not. And we might even display it to other users, like John is enjoying his time at the museum today. But this was really sensitive to most of our participants, because participants like to be able to disguise their emotions. And if the system displayed their emotions, their moods to their friends, well, this would open up huge privacy issues and cause problems. If it said you were sad, for example, well, maybe your friends would come around and try and cheer you up when all you wanted was to be left alone. Or if it showed that you were angry at a friend, well, you wouldn't want that to be made concrete and put in writing. Far better to let it pass and forget about it. And we asked more questions. But the two things that stuck with us through this part of the study were these. First of all, it's not easy to map information disclosure preferences onto groups of friends. It's a highly individual matter. Some people can be trusted, some people can't be trusted. And it's not really about what group they're part of, it's about individual characteristics. And secondly, we realized that the most problematic privacy issues weren't about strangers seeing your information, because who cares whether a stranger knows whether you're happy or sad or angry? That's irrelevant to them. But if your friends saw it and they knew the context of that information, then that could cause problems. In our second study, then, we wanted to continue to explore the privacy concerns that people had within their groups of friends. But how could we make sense of the different ways in which information could relate to a user and to others? Make sense of the different ways in which information could be hidden or open to others. And we needed a simple way of relating these different relationships to the user. And for this, we used a psychological technique known as the Johari Window. And briefly explained, Luft and Ingham in 1961, I think, they introduced this model as a way of explaining to people their relationship to other people and what other people knew about them and how they could develop their self-awareness. But applied to privacy, it becomes a really helpful way of thinking about a person's relationship to their data. So in the open and hidden quadrants on the left-hand side of the diagram, These are the things that we would normally consider in privacy research. You've got the open quadrant, where people share information openly with friends or family or whatever. In the hidden quadrant, you've got the information which you know, but other people don't know. But then when we get into the right-hand side of the diagram and look at the unknown and blind quadrants, we start to think about some interesting concepts. The blind quadrant is information which others know about you, but you do not know. And the unknown quadrant is information which neither you know nor others know about you. And this information which you don't know about yourself was fascinating to us because in the context of our social network system, with it gathering data about a person's physical and social activities, perhaps even their moods, the system would know more than the user. But would the user want to know that data? So in our second study, we got a bigger group of participants, some 20 older adults, and asked them about who they would share information with in the system and when and why and so on. And there's more details in the paper. I'm not going to tell you the details about the open and the hidden quadrants because they're fairly straightforward. We're interested in how participants would treat information that they don't know about themselves. So in the blind quadrant, we've got this category of information which others know, but you don't know. And we had participants talking about how the machine might know information about their mental well-being, their health information, and how in some circumstances they would want their friends to know that, even if they didn't. So if they were behaving differently, forgot their friends' birthdays, for example, they would want their friends to know that it wasn't that they'd forgotten about them, it wasn't that they were being rude, it was simply the fact that they were unable to remember in some way. So they wanted to reassure their friends, even though they might not know that information themselves. And perhaps it's this unknown quadrant that's most interesting. In previous literature, there's been a lot of discussion about when to tell patients about illnesses when they're in a period of decline, intractable decline, terminal illness at times. When do you tell a person that they've got a terminal illness? Especially if it's going to mean that they're going to slump into depression. And essentially, I would want to argue that it's about keeping their own data private from themselves. Now, you can come back at me if you think that's a bad way of framing it, but that's the way I like to think of it. And in the context of our system, participants thought about how the system might know more about themselves than they know themselves. What if they were playing games? Something along the lines of Candy Crush, and it's monitoring their cognitive ability, their ability to engage in these games, and it saw that they were going downhill. Participants said that they wouldn't want to know about that. Other participants said that they wouldn't want to know if their steps were declining, especially if they couldn't do anything about it, because then it's impacting upon their self-identity, their future identity. And maybe it's a strange way of thinking about it, but I think it's about wanting privacy from your own data. So by using the Johari window, we're able to open up another area in which privacy is relevant for our social network system. In the first study, we see that privacy is often about protecting information from your own friends. And in the second study, we see that it's sometimes about protecting information from yourself. So what are the implications of design? And with this, I'll finish. Firstly, existing controls for privacy are rather clunky at times. We can assign people into different groups, friends, family, and so on. But what about the fine-tuning within those groups? And one way of solving this might be to create multiple overlapping groups based on the characteristics of your friends. In which case, when it comes to share certain information, you can share information at the intersection of certain groups rather than whole groups. And maybe that's over-complex, so too complicated for older adults, in which case we need to think, and we're continuing to think about this, how to develop simple ways for older adults to adjust privacy settings. And secondly, in a system that encourages users to be more physically and socially active, it's worth remembering that sometimes it may not be very encouraging to them to share information with them if it's going to impact on their self-esteem, discourage them from being more physically and socially active. In other words, sometimes they may need privacy from their own data. One way of solving this might be to show their data, step counts, whatever else it might be, in terms of a smaller time window, so that they can actually have something that they can improve on, rather than showing a longer period of decline in which there's no way of reversing that trajectory. Such privacy from their own data would protect their self-esteem and encourage them to continue being active. Now, these are only a few brief thoughts, but hopefully they stimulate you and help us to think more about the complexity of privacy, particularly for older adults in the context of social network systems. I'd like to thank my funders, the European Union, and the Canto project, which seeks to develop this network. Thank you.
Hi, Maria Walters, University of Edinburgh. Thank you very much for a very interesting talk.
Thanks.
I wanted to pick up on the second point, which is protecting people from their own data. Mm-hmm. First of all, I want to highlight that, and I say that as a data scientist who's doing studies in this field, that the science of predicting dementia or depression from that kind of tracking data is very much in its infancy. Yeah. To the point that I would actually question the ethical implications of sharing that with users.
Yeah.
So I'm currently involved in such projects,
right.
But I think your results are very important because they also highlight that even if that information is present, should it be shared? And if it is shared, if it is surfaced, how is it surfaced?
Yeah.
And
definitely those ethical considerations weren't something that I've actually considered, and it does show that privacy is really an ethical issue, and when you've got information about decline, you've got to consider that question. I'd like to chat more.
Yeah, but you're assuming that you have actual information about decline. Within the framework of responsible information, responsible research, I would say that the information that you have about decline has a big uncertainty associated with it. Yeah,
I totally agree. And because this is kind of the conceptual stages, it's not that we've actually got that data. It was more about exploring what if we had that data, how would people respond to it? But perfect, yeah.
Love the talk. Jeff Warshaw, Google Security and Privacy. So it seemed like the big focus was on kind of the social relationships and how data could be, feelings about data privacy and social relationships. Did anything come out about kind of the system having the data or other, unknown people having access to data that system is then collecting?
Yeah, so we have tried to gather some data about would people want the computer system to know it? And so we did a follow-up questionnaire. Unfortunately, when we asked people, would you be happy with the computer system knowing this information? I think they've gotten really confused and they've conflated ideas about administrators and people accessing the system at that kind of level and just a non-sentient machine having the data. So I'm afraid my data and that's actually just a bit conflated. So I'll need to explore that issue in more detail.
Yeah, thanks.
Thank you.
So I have a question that's a bit of a remix of your work and Abby's work, actually. Yeah. What do you think about providing a chance for older adults to reflect on how their choices on privacy are working out for them? So maybe they might think about it the first time and come up with a set of reasonable choices, but then something happens and maybe helps. They want to change something, or maybe it's useful to help them reflect every once in a while as to how things are going.
Yeah, well, one of the things that I would like to see built into our system is a way of, this is already built into some social network systems. I think maybe Google Plus has it. You can view your profile from the perspective of another user. You can choose whoever you want and then see it as they would see it. So I think that's maybe a nice way of helping older adults work through that. Do you get any thoughts on it, Abby?
It's really funny, I really enjoyed your talk, and it's such important work for this community. And I actually really agree from a design perspective. I think there's a really rich space to explore. Kind of thinking about how to build in those mechanisms for enabling a kind of reading and reflexivity in people, to give people the space to make judgments and to promote that awareness, and of course, again, respecting. It's so different for different individuals. But it's clearly even understanding what privacy means. Is, as expressed, in all the talks this morning. It's a really complex space, isn't it? There's a lot of misunderstanding.
Exactly.